Okay. And can you see my screen?
No.
Okay, you should be able to see it now.
Yeah.
Okay. So we're going to start from first. Long-term care. Our presentation's on long-term care. And our scenario is your parents are caregivers to your elderly, mentally handicapped uncle. He fell and broke his hip. He is currently in the hospital but will be released soon, and your parents will no longer be able to fully care for him at home. Because you are a healthcare administration major, your parents need your help to find the right long-term care facility for your uncle. Find and contact at least 2 facilities that can offer the appropriate care for your elderly uncle that needs therapy for his hip, as well as help with medication, food, and hygiene. Obtain all the costs and care information needed to make your decision. So the first place we found was Legacy House, which is located in Logan, Utah. Of all the facilities in Logan, Utah, this facility had the most welcoming and friendly staff. It also had a very home-like feeling. It is located within a block of a major hospital. I felt like it was a place that the uncle would feel very comfortable in and receive the care he needs. For those reasons and many other, this facility made it onto the list of facilities that were found to be suitable. This facility accepts Medicaid through the New Choices program, which is a program in Utah. The uncle would qualify for this program because it is for adults between the ages of 18 and 64 who have a disability or are over 65 years old. Although at the time of my visit, the facility was unable to give me the exact cost that the program would pay per month, Medicare doesn't provide any coverage in the state of Utah for assisted living facilities. Out-of-pocket payments from the patient is due on a monthly basis. This facility has base monthly service fees and then charges another amount based on the level of care needed by the patient. On the following slide is a breakdown of the costs and what they each include. Legacy House's base monthly service fees are for a studio. It starts at $2,535 per month, and that includes a kitchen area, bathroom, living area, bedroom area. And then a 1-bedroom starts at $2,935 per month, and it includes a private bedroom, kitchen area, bathroom, and living room. And then a 2-bedroom starts at $3,700 per month, and it includes 2 private bedrooms, 2 bathrooms, a kitchen area, bathroom, and living area. And we would recommend the studio because since it's just the uncle, he wouldn't really need a 2-bedroom or a very big space. The pricing based on the level of care that is added onto the monthly service fee. For independent care, which is $0 to $500 per month, it includes 3 meals per day, 24-hour emergency response system, daily safety checks, weekly housekeeping and linen services, religious, cultural, and recreational activities, and minimal assistance with ADLs. Primary care is $600 per month, and it includes everything covered under independent care and some assistance with ADLs, medication counseling, and supervision, and occasional reminders of events, activities, and other important items. Extended care is $800 a month, and it includes everything covered under independent care and regular assistance with ADLs, medication counseling, supervision, and administration, frequent reminders of events, activities, and other items, and assistance with manageable incontinence. Comprehensive care is $1,000 per month, and it includes everything covered under independent care and frequent assistance with ADLs, medication management, and administration, regular and frequent reminders of events, activities, and other items, and assistance with incontinence. Amenities that are available at Legacy House to anybody that lives there is on-site laundry room, a beauty and barber shop, library, activity room, game room, and fitness room, and therapy room, private dining room, emergency response and security system, common areas for visiting with neighbors, friends, or family, walking past flower gardens and water features, grab bars throughout the facility, and individually controlled heating and cooling systems.
Okay, I did research on Morningstar Senior Living Center in Idaho Falls. So in visiting them, I found out that they support ADLs. They have around the clock 24-hour medical care and supervision. They have case managers on the floor, and they have RNs on call every day. As a patient there, you'll have access to advisors, therapists, counselors, lawyers, financial officers, anything you're seeking out professional help, they have that available. Physicians, they offer primary care, um, and they also have care for chronic illnesses and holistic care, which I thought was really interesting. They offer IV infusions, which is sort of an alternative medicine because insurance doesn't typically cover that. Um, their website had 32 pages worth of different floor plans, and the square footage provided as well. Morningstar does accept Medicare, and they went into the benefits on their website saying that Medicare benefits will cover home health care, but only if specific conditions are met. They currently are not accepting Medicaid. For their medications, they do go through Heartland Pharmacy, which a lot of other assisted living facilities use in Idaho Falls. They are a delivery service. Um, and they offer many financing options for those who are just looking to turn over to a assisted living facility completely. I guess selling your home, which was new information to me, is a huge financing option for patients that are looking into this. It provides a lot of financial stability for them where their insurance won't cover as much. They offer bridge loans, tax benefits. Um, that's all that I saw. Morningstar also had like 3 different comparison sheets that they offered to anyone looking. This one is a monthly expense comparison. They have where you can compare your mortgage, your real estate taxes, your housekeeping, your yard maintenance, 24-hour care staff, and they just help their future patients make the right decision by giving them comparison charts with different expenses to consider and to compare when choosing a facility. Some of Morningstar's amenities, they have fitness rooms, a theater, spa, a life enrichment room, a game room, a bistro, and a courtyard. For their pricing, their monthly expenses for patients will range between $2,500 and $3,600. The room pricing varies, on the floor plan that you choose and how many square feet you want, and whether you're going to be living in an apartment or a private home. And they also offer suite and care package pricing, similar to the one in Utah. They have it broken down. What was cool is that they don't have a contract commitment, so you can go month to month if needed. And the price also depends on your medical history and your current history and what your medication needs will be on a daily basis. And after doing an examination of what your healthcare needs are, you'll be put in a scale of 1 to 5, and that'll also take place in your monthly expenses. So when we decided what would be best for our scenario for what we were given, we decided that the Legacy House would be the best fit for our uncle. This facility offers the necessary means to maintain his health, hygiene, medication, mental wellness care, and physical therapy for his hip. The insurance details weren't available in this scenario, and where Legacy House accepts Medicaid, which based on the little information we were given, we would assume he would qualify for. We decided this would be the best financial decision due to Morningstar not being in contract with Medicaid. Ultimately, Legacy House offers our family member more options and has better financial flexibility.
Okay, so in our research, we found success, difficulties, and advice for those searching for assisted living facilities. The successes that we found when we were searching were that going to the facility personally made it easier to find the necessary information. Going to the facilities allowed us to see what the facilities looked like in person and not just in pictures. Reading reviews online about the facilities seemed to be very beneficial. The facilities' websites provided good information on the amenities. By looking on the website before going to the facilities, I was able to know what the facility had and what I wanted to see. Morningstar offering documentation to help aid a patient's decision in long-term care. The difficulties that we found were none of the facilities that we looked at had financial information listed online. Being asked the specifics of insurance premiums and other benefits and local physicians. There seems to only be one person at a facility that can answer questions about cost and reimbursement, and to catch them when they have a free second was difficult, so it's important to schedule an appointment so that you know that they're there. Um, Advice is knowledge of long-term care facilities can come in handy when looking for facilities for families or assisting patients in finding one. It's important to know what are important features and necessary in order to create a good experience for your loved ones while they're there. Gather as much personal information as possible. This will help you establish a budget and understand your options. For example, Social Security, existing debts, insurance plan coverage, living wills, or retirement details. And that's the end.